Hello, my name is Ashley Wynn, and today I'm going to be discussing the autoimmune disorder, eczema. Just a little bit about eczema. It is formerly known as atopic dermatitis, but more commonly referred to as just eczema. The mechanism for this disorder has been up for debate until recently. As of last year, 2021, it was confirmed to be an autoimmune disorder. And even though it has been confirmed as an autoimmune disorder, the mechanisms for this disorder is still largely unknown. The response is a cell-mediated hypersensitivity response that is associated with subtypes of T cells that migrate to the surface of the skin and secrete specific cytokines to help with the inflammatory immune response. And oftentimes it's also associated with elevated levels of IgE serum and sensitization to a variety of allergens. There is currently ongoing research with the protein filaggrin. That is the protein responsible for maintaining skin moisture barriers, and research shows that mutations in this protein has led to the skin becoming dry and prevents maintaining the skin moisture within the skin. Approximately 31.6 million people in the US have some form of eczema, which is about 10.1% as seen in the pie chart to the right. 2.4% of the population is affected worldwide by eczema, with a higher percentage found in children, that is 15 to 20%, and 50% of the percentage of children with eczema go on to develop asthma, and research shows that people who have eczema are more likely to develop asthma or vice versa. And this disorder does not discriminate, where it affects people of all skin colors and types. Although this disorder is not fatal, severe, uncontrolled, and untreated cases can lead to life-threatening complications and other health risks. And oftentimes, eczema also is associated with developing secondary infections later on. And overall, 66% of the population that have eczema have noted that this disorder has affected their daily lives some way, somehow, whether that be them just going to school, or sitting through class, the itching, the rashes. It's almost like a tick with an urge to keep on scratching, so it takes away from whatever you were doing, as well as a good percentage of the people surveyed also said that the disorder is oftentimes associated with mental health issues, where the constant itching of the rashes worsens the rashes, and it's all over the body, which is a big insecurity for some, which also takes away from their confidence in doing things, as well as day-to-day things that we don't really think of. Some symptoms of eczema include itchiness, skin discoloration, rashes, redness of the skin, scaly texture, swelling, oozing, dry skin, and these are just a few of the symptoms, and it's just not limited to just these. There are more, but these are just like basically the hallmark characteristics that you would find. Although sometimes scratching can exacerbate the redness and all these symptoms, it is not contagious. It cannot be passed on from person to person. And in extreme cases, such as environmental triggers like cold weather, when your skin is more prone to being dry during those winter months, it is difficult to control, and there are flare-ups. And the images over here to the right, you can see the redness, the discoloration, and the constant itch. And it could be found all over the body and worsens as you itch. The causes of eczema occurs as a result of various conditions that include a combination of immune system activation, genetics, environmental triggers, and stress, such as allergens, weather, and as I mentioned earlier, during the winter months, your skin tends to be more dry. That's why you usually try to moisturize during those months. Alternatively, there are other causes that is more associated with skin to skin like direct skin contact with irritants such as soaps, detergents, shampoo, body wash, and these tend to be higher in pH, as well as they all have, or they usually have fragrances because we all like to smell good. But it also irritates the skin, especially those who have dry skin or sensitive skin. And as you can see to the image to the left, you can see the scratching, the itching that breaks that skin barrier that allows microorganisms to pass through this barrier. And our hands are dirty, so whenever we scratch, not only does that break that barrier, but it allows infection to come in or worsen the severity of your rashes and eczema case in general. The approach taken to diagnose eczema, a physician would typically go through the patient's family history as well as conduct a physical examination. Most of the things the doctor would look for would be symptoms of itchy skin on top of 3 of the additional symptoms labeled 1 through 5 on the left, and that consists of history of asthma, which is associated with the elevated IgE levels, history of dry, sensitive skin, history of flexural involvement, and flexural eczema describes the location at which the rash occurs. And specifically for eczema, the rashes occur predominantly on the elbows, the knees, which are the flexural regions. And although it can occur throughout the body, these are like the main hallmark characteristics that differentiates it from other disorders. It is usually induced by allergens, such as environmental triggers. And then back to number 4, skin rashes prior to the age of 2. Lots of children, in the previous slides, children had a higher prevalence of having eczema, as well as visible flexural dermatitis, which is just the main regions where you would find eczema cases in a patient. Although eczema has certain hallmark characteristics, sometimes it's hard to differentiate between eczema and especially psoriasis, which is another autoimmune disorder. So basically, a physician, in textbook examples, it's easy to identify the specific hallmark characteristics of both eczema and psoriasis, but in the case that a patient comes in and it's hard to decide between which one it is, the physician can take an approach to treat one and then kind of see how that results, if it makes improvements, and if not, rule out the other one, treat for the other one to determine your diagnosis. And a little compare and contrast between the two. Psoriasis is also an autoimmune disorder caused by rapid, uncontrolled growth of the skin cells. It is typically less itchy, which is a main symptom that physicians would look at when diagnosing, because eczema, on the other hand, has severe itching. It usually occurs at the scalp, elbows, knees, face, back, palms of hands, soles of feet, and kind of similarly to eczema, it occurs at the knees and the elbows. But to distinguish between the two, typically eczema is on these mainly on the flexural surfaces, which is the elbows and the knees. And then eczema, on the other hand, is a disease caused by mutations in the proteins I mentioned earlier, the filaggrin, and the top protective layer of the skin. There's an intense itch associated with this, and then it can occur all over the body, but mainly in the flexural regions. And then in regards to these images, on the left is psoriasis. You could usually see in psoriasis, it's more patchy and scaly and kind of flakes off more, as well as you could see the ridges on the bottom right, the ridges on the edge of the psoriasis rash. It's like a distinct circular, kind of a circular patch, whereas eczema seems to be more spread out. And like I said, the images shown on here are more of textbook examples, which are easier to diagnose, but usually, or these cases could also be seen to look very similar, so it's harder to distinguish between the two. Unfortunately, there is no cure for eczema. Symptoms can worsen and lead to infection, or worsen if left untreated for a prolonged period of time. Like I mentioned earlier, the mechanism is still unclear. However, there's treatment to improve the quality of life of people suffering from eczema. To begin, there are home remedies such as taking cool showers, usage of soaps, detergents, perfumes, etc., with low pHs and no fragrances. Emollients, which are moisturizers, you'd like to moisturize as frequently as possible to keep your skin moisturized. There are topical creams. Some you could get over the counter, as well as dermatologists can also prescribe topical creams such as tacrolimus. And cool fact, there are certain topical creams such as tacrolimus that can be compounded by pharmacists to specifically meet your eczema case. And then I would say in more severe cases, a patient suffering from eczema can take biologics, which are immunosuppressants such as Dupixent. And I will note, with biologics, there's a lot of things to consider, such as side effects, as well as keeping up with consistent labs in order to take this medication. Alternatively, there is phototherapy, which is a UV light that dermatologists can shine on you or the surface of the rashes where the white blood cells would leave, which reduces inflammation in the skin. And then on here, I also included antibiotics, and I left it on here because it helps with only the secondary infections that can arise as a result of eczema later on. It does not directly treat eczema, but it can treat the secondary infections associated and can develop from eczema later on. These are my citations. Thank you for listening. This concludes my presentation, and I look forward to answering your questions Monday. Thank you.